Okay, you ready for this?
I'm ready.
Okay, so today just a little information. I know we have patients asking, should I get a bridge? Should I get an implant? There is pros and cons of treatment options. So for example, if you're missing a tooth in the back, typically, let's say if I'm drawing a lower teeth and you're missing a tooth there, it looks something like this. Okay, so this tooth is missing. Generally have three options. Option one is just something removable. Could be a partial, it could be a flipper. Obviously I would recommend it, especially if it's in the back. Okay, you're gonna break it, it's uncomfortable and all that. Option two is what we call a bridge. A bridge is basically using 1 and 2 to fill the space. But guess what you're doing? You're cutting, you're prepping these two teeth to fill that third one. So for example, the bridge would look something like this. Okay, so here it is. So there will be one connected. The problem with this bridge is you can't floss. If something goes wrong with this tooth or with that tooth, this whole thing goes down. Okay, that's the disadvantages of a bridge. The advantages are, one, it can be done quickly in a matter of a couple of weeks. If you've been missing a tooth, you can have a bridge, you're done. And two, if let's say this tooth needs some work, it needs a crown, that tooth needs a crown, you really need to get the work done anyway, and you have a limited budget, a bridge can actually also work. Those are the advantages. Obviously, the disadvantages I already discussed. You're relying on these two teeth and to get that. But the best option would be a single implant. So what does that mean? It means that, let's say you're missing a tooth here, without really touching these two other teeth, all you have to do is you can have an implant placed. So this right here literally mimics or kind of copies the root of this other teeth, and then there is you put it in from a extraction standpoint. If you had a tooth taken out in the past, implant placement is no different than taking a tooth out. So it's not super painful or anything like that. Usually done in a local anesthetic and it's done. It's very straightforward, nothing to be scared of. It's not scary. Frankly, I would prefer this one over the tooth taken out. Okay, so what does that mean? It means that once we put it in the bone, we let it heal for about 3 months. So typically it would look like this. We put a little bit of what we call a healing cap. So on an implant, you'll see something that would stick out like this. That's it. For about 3-4 months, you would have something like this. Then once you hit the 3 months, once everything is kind of healed and this becomes part of the bone, everything is healed nicely, then we take this guy off, we remove, we attach what we call a custom abutment. And so that connects this piece with the root so that we can go ahead and put a nice single crown. So just to summarize, this is your final implant. And you can see it has a root just that mimics the root, and it has what we call an abutment usually, and then it has a nice crown. You can kind of see that. Okay, so you didn't touch that tooth, you didn't touch that tooth. Now everything is level, your bone is filled up, and your teeth are all filled up. Okay, that's kind of the treatment option when you're missing a single tooth. This will be your best option. Implant is the winner.